Hello and welcome to my YouTube video. In this presentation I will explain what is meant by the term leveraging. This leveraging is the biggest reason other than healthcare trends that insurance rates go up so much every year. So what is leveraging? It's easiest to understand what leveraging is by working through an example, which I'll do in a moment. But for now, I'll tell you that leveraging refers to any time one trend, a number, translates into a higher number. In the insurance world, we usually mean specifically deductible leveraging. This kind of leveraging is more and more pronounced the higher your deductible. For leveraging to have any effect, there has to be one impact that is leveraged into a bigger impact. The firm PricewaterhouseCoopers has a free report right now on their website on how fast they expect the cost of healthcare to go up in 2010. This rate of increase is what we call health cost trend. According to PwC, medical costs will grow 9% in 2010. I think this is a very accurate estimate. This figure is right in the middle of the range that I'm seeing right now in my work as a health actuary. In this video, I'm going to walk you through an example where this leveraging will start with that 9% figure for health cost trends, and just through deductible leveraging will turn into 17.4% in needed health insurance rate increases. And then, through another layer of leveraging, how that figure can turn into an increase greater than 50% in terms of how much you pay for health insurance. For my example, I'm going to use a case where somebody gets their insurance through their employer. Let's say you're an average member with an average health insurance plan. You probably have about a $1,500 deductible with 20% coinsurance. That means after your deductible, you pay 20% of your remaining cost, and the insurance company pays the rest. Let's say you have $8,000 in total medical charges in a year. This could be a combination of visits to your doctor's office, a trip to the ER, shots for allergies. Heck, a single trip to a hospital for a surgery or a serious illness could put you well over this figure. But again, we're saying this is for an average patient. Your insurance company has discounts with providers, which typically save you a good $3,000 or more. So let's say you save $3,100, which leaves $4,900 to be paid between you and your insurer. We call these your allowed medical expenses. So let's take that $4,900 in allowed medical expenses. Before your insurance company pays anything, you have to cover that $1,500 deductible. Out of the remaining $3,400, you have to pay 20%. So that means $680 paid by you. This leaves $2,720 paid by your insurance company. This $2,720 paid by your insurance company is what they have to cover your insurance premiums. So they charge enough to cover their expected claims. But what about next year? How much will they need to charge then? Let's do the math. We start with the total $4,900 that you and your insurance company paid together. These are your total healthcare cost. That's the amount that's going up 9%. To see how much your total costs are going to increase, we multiply the $4,900 by 9%. You do the math and you find out the average member will have about $441 more in healthcare costs next year. That gives you a new total of $5,341 average healthcare cost. So let's take that $5,341 and let's say you stay in your same health insurance plan. Then you pay the first $1,500 in the form of your deductible, and after that you pay 20% of the remainder, or $768 in coinsurance. Your insurance company pays the remaining 80%, or $3,073 a year. As I walked through that example, did you see how much the insurance company's part went up from one year to the next? It started out at $2,720 and went up to $3,073 the next year. That's 13% in just 1 year. So just like that, a 9% health cost trend translates into 13% more paid by the insurance company. The insurance company raises their rates to make sure they have enough premium to cover this increase. That's leveraging. We've been talking about medical cost, but your pharmacy benefit works the same way. Let's say you take a drug each month that costs $70 after discounts from your insurance. And let's say you have a $25 a month copayment for it. So your insurance company has to pay the rest. That means they're paying $45 a month. Over 12 months, they're paying $540 a year for that one drug. But what about next year? Let's say that $70 drug you were on goes up 9%. Now it costs $76.30. If you're in the same health insurance plan, then you're still paying $25 a month copayment for it. So your insurance company has to pay the rest. Now they're paying the remaining $51.30 a month, or about $615 a year. So what happened to the insurance company's portion? It started out at $540 and went up to $615. That's a 13.9% increase. So on the drug side, that 9% health cost trend translates into 13.9% more paid by the insurance company. That's a big difference. How did that happen again? The total cost of your drug was $70 in the first year. After that 9% trend, the cost went up to $76.30 for the second year. But the part you paid each month was just $25 for both years. So the remaining $45 in the first year went up by more than 9%. Since your part didn't go up at all, the insurance company piece increased 13.9%. Now, for your other medical cost, it's just a little more complicated. The total cost paid by you and your insurance company together go up 9%, but since you pay 20% of whatever's left after your deductible, if you stay in the same insurance plan, then the portion you pay does go up from the first year to the second. But notice that the green part, paid by the insurance company, goes up a lot more than what your blue part does. So even though the whole bar on the left grew by 9% to get to the bar on the right, the blue part, your portion, went up by less than 9%. That means the green part, the insurance companies, had to go up by more than 9%. Again, this is what we call leveraging. Now you'll remember that I said leveraging is more pronounced the higher the deductible. So let's look at a second scenario just real quick. Let's say your deductible is $2,500 instead of the $1,500 from before, but you still have that same 20% coinsurance. Do you remember how our first example had $4,900 medical expenses a year? If you have a $2,500 deductible, that leaves $2,400 left to pay after your deductible. Out of that, you'll pay 20%, or $480, which leaves $1,920 paid by the insurer. But next year, when your total medical costs go up to $5,341, then what happens? You still have that $2,500 deductible, which leaves $2,841 to be paid. You pay 20% of that amount, or $568. That leaves $2,273 to be paid by your insurance company. So this time, the insurance company's portion started out at $1,920 and went up to $2,273. That's an 18.4% increase. Now, let's blend the two pieces together. In this higher deductible, you had an 18.4% increase in your medical coverage. If we say you had the same pharmacy coverage as you did under the first scenario, then you had a 13.9% increase in your drug benefit. You put the two together, and you have a 17.4% total increase in the cost of your health insurance. In our first example, that 9% medical trend turned into a 13% rate increase. With a higher deductible, it turns into a 17.4% rate increase. And this just gets worse the higher the deductible that you're on. If your deductible is more than $2,500, that 9% could easily mean 20% or 25% or more. It all depends on your deductible, your copayments, and your out-of-pocket max. Do you remember how earlier I said we'd start with that 9% figure for health cost trends and would jump up to 17.4% from deductible leveraging? Well, we just showed that part. But then I mentioned how that figure can turn into an increase greater than 50% in terms of how much you pay for health insurance. This second layer of leveraging happens when your employer helps pay for your coverage. Let's take a simple example and say that your insurance costs $200 a month. Let's say your employer covers 70% of your premiums. So that's $140 a month. That leaves you with the remaining $60 a month taken out of your paycheck. These numbers are low because we're assuming you're just getting coverage for yourself. But next year the rates go up 17.4%. That means the new rate is about $235 a month per person. Your employer was already paying $140 a month. In this difficult economy, your employer might not have the cash to raise their portion 17.4%. So let's say they increase their part about 3%, something close to inflation. That would mean they're now paying a little over $144 a month for your health insurance. The rest goes to you, which in this example is $91 a month. Did you see what happened to your portion? It went from $60 a month up to $91 next year. That's more than a 50% increase. So just like I said, that 9% figure we started with instantly turns into 17.4% in needed health increases. And then that number turns into a 51.7% increase in how much you pay for health insurance. There's nothing dirty or underhanded going on here. It's just two layers of leveraging, one coming from your deductible and the other from your employer's contribution. These are real numbers representing real situations all across our country, and all of it starts with that 9%. But here's the thing. Employers don't like to hit their employees with 50% increases, so they offer you new insurance plans with higher deductibles and higher copayments, which will lower your premiums. But all those changes may bring that 51% down to, say, 30%, or some other number that is still very high. Now, I know I just went through a lot of numbers. If you want to check my math, I will save my spreadsheets out on my website at fixthehealthcarebill.com, where you can find the same information on theanonymousactuary.com. If you would like to see more of my videos, subscribe to them on YouTube. so you'll be notified anytime I post a new one. Thank you for your time watching today. And remember, my videos are not intended to stop healthcare reform. We need healthcare reform in this country so that all of us can afford good coverage when we get sick or injured. But we also need to realize the truth about the reasons for the rate increases we all face. Thanks again, and have a great day.